Starting. All attendees are in listen-only mode.
Good afternoon, everybody. It is the first day of, or actually the second day of January 2014. We want to welcome you here to our webinar, our live webinar. Today, Patrick and I are going to talk about the top challenges that the doctors face in 2014, and then how you can take those challenges and actually make some profits off of those. So, as you can see, we are celebrating in the left-hand corner of our screen 20 years here at American Business Systems. And for those that are somewhat familiar with what's going on with Meaningful Use Stage 2, you can also see our seal that we are certified Stage 2 upper in the right-hand corner of our screen today. So again, for those that are coming in, we want to welcome you here today, and we're going to get started here right away. Again, my name's Eric Auger. I'm the Director of Research and Development here at American Business Systems. And certainly all the things that we're going to be talking about today have been somewhat researched and developed here, just right here at American Business Systems. So we want you to be confident that the things that we're teaching, not only in our training class, the things that we're going to be talking about here today on our webinar, are things that we're actually utilizing and going through. Now, for those that have been on our webinars before, you pretty much know that you can, at any time, type in questions, and throughout the session today, we want you to do that. But then for those that have never been on our webinars, the first thing we'd like to ask everyone to do is to click this little hand right there. That allows us and gives us the information back that you're hearing us loud and clear. So I'm already seeing hands come up. Frazette, it's good to see you. Ron, good to have you here. Happy New Year to you. Chris, it looks like you're on. Carla, Sam, good to have you guys on here this afternoon. There are still other people coming on. And for those that will be coming on here in just a little bit, you'll see that we have our phone number down here and the access code for you to join us audio-wise. Again, I'd mentioned earlier, for those that have not been on our webinars before, you can see that we have a question area that we'd like for you to type in your questions. So as Patrick and I are going through information today, feel free just to type in a question here and we will go over it with you live today on the webinar. Well, again, for those who are first joining us here, we want to kind of review who American Business Systems is. And so what do we do? Well, we help people like yourself that are looking to start a business, some type of business opportunity, trying to get involved with some type of franchise. And then for those that have looked in those categories, you've noticed and may have run across us. But again, what we've done for the last 20 years is help folks just like yourself, being able to give them the opportunity to, a lot of our licensees work from home. And then for those that want to open up a larger office, certainly you can do that. And we've got folks all over the country that has actually opened up large offices. We supply you with the latest and greatest software that is actually on the market today. We are one of the only ones that know that we can, through a web portal, check eligibility right in our own system, not have to go outside that system. This is a web-based system, so you don't have to load anything on your computer, and you can see you can get it on any type of platform, whether it's an Apple iPad or an Apple desktop or a PC, it doesn't matter. You can access our system on there, and we'll talk a little bit more about that and how you can utilize that to help those doctors of what they're facing today in 2014. Again, for those newcomers that are on our webinar today, you're going to want to check out our website. It's absystems.com. Just go there. We've got a lot of information already out there on the web that you can go out there and research and do your due diligence. But for those that want to get a little bit deeper study, right here where it says click here or get started here, go there, click that button there, and that will get you over to our virtual brochure. Now, in our virtual brochure, we have tons of videos. We've got scenarios. We've got all different types of ways that you can see the profits of what you can make with each of these services that are being shown here. So please take your time to go through our virtual brochure. Again, for those that are interested in the Better Business Bureau, we are still with an A+ rating here with the Fort Worth Better Business Bureau, so you can check us out there. For those that would love to come by and join and visit us, meet with us face-to-face, visit us before you actually come to the training class, or before you make that decision, please take our address down. It's 5751 Kroger Drive here in Keller, Texas, 76244. This is a community just north of Fort Worth, so you just need to fly into the DFW airport, and we'll make arrangements of picking you up and bringing you on out here. Now, for our first training for this year, it's coming up just right around the corner. I think we're talking about 2.5 weeks away, January the 20th through the 24th. And we still have room, although that number is starting to dwindle down. We're about halfway completed there on capacity. So please, if you're looking to get started here, and as you'll see on today's webinar, there's a lot of things going on for 2014. Also, Patrick, for celebrating 20 years here at American Business Systems, every licensee that shows up at that training will receive a mini iPad. So this is our January incentive for those that are looking to get started here. We want to get you started off with the right foot and with the right technology. This way you can show those doctors that information I showed you about their software, and we'll certainly help you out with that also. Let me introduce to you Patrick Phillips. He's our CEO and founder of American Business Systems. He's an author, a speaker, and more than that, just a great friend. And you'll find out yourself, not only will he be a great motivator for you, but you will find out that Patrick is going to be one of the greatest friends that you'll ever want to have on your side. But he's written a couple of books here. Want to share those with you, How to Reprogram Yourself for Success, and then on the right, Cash Crunch, Cash Flow. We're going to be talking about that particular book. But either of these books can be researched and seen on Amazon.com, so you can certainly get you a copy there, or get us in touch with us. We'll see about arranging to get you a copy as well. Patrick is also an author of several of the major magazines out there with healthcare billing and coding. This one is the BC magazine, Billing and Coding. He's on the editorial board here. Matter of fact, this is the most recent article. This is the December and January 2014 article that was just published here, how doctors can cut their billing costs up to 50%. And, well, with that said, Patrick, why don't you turn your video camera on? It's good to have you here. Happy New Year to you, sir.
Happy New Year to you. You sound a lot better this week, Eric.
Let's. There we go. Much better. I'm feeling so much better. Thank you for asking.
Yeah. Well, hey, that's amazing that people are still showing up here. Here it is, a little after the hour, and they're still popping into the room here. So I guess they're just kind of laying around, not doing anything this last couple of days of the week, at least.
Yeah, there's a few. I know that my son, he doesn't go back to work till tomorrow, and I know a lot of people will actually get started next Monday. But for those that are on here, welcome here. And again, for all those that have just come on, again, Happy New Year to you.
Well, let's start out with this article that Eric just found today. That's just an amazing way to start out this webinar, Eric. I love this. This was back in, looks like November there, November 1st on examiner.com. And it's a great article. It has the market for medical billing practices eroded with Obamacare. We get that question a lot, don't we, Eric?
We do. And I tell you, whenever I started researching some more topics to cover today, and I ran across this, I thought, my goodness, what a question. And it's a question that, like you said, we get asked quite a bit. But I'm telling you, what's in this article is unbelievable.
Yeah, let's kind of read the beginning part of it here to folks just so they can get a feel for this. And by the way, you can find that on examiner.com. There it is right up at the top there of their website. Medical billing practices in generally have taken hard knocks over time due to criminally coding and proactively robbing our government agencies of billions of dollars taken back out of taxpayer pockets. They're talking about the fraud that's been committed by some medical providers with Medicare, billing for things that never happened. Oh, there we go. That was the first rule, right? Take your phone off ring. Anyway, because Obamacare will overhaul the way doctors and medical coders work, finding an affordable, HIPAA-compliant resource for legitimate billing, laser-accurate Medicaid and Medicare coding, and precise handling of all home medical supplier billing done correctly the first time may be harder than ever. So let me just go to the next slide here, because this is the part of the article that I really wanted to show. The recent turmoil with healthcare reform and medical practices in general has led many medical billing companies to rethink their hiring, training, and relationship management strategies. There are many healthcare facilities that are actually rethinking their medical coding budgets for the coming year. The good news is that even with the latest changes, medical billers will continue to yield the highest return on investment for everyone across the board. Now, Eric, just so people, for those who are new, can wrap their brains about what's being said here, medical billers, that's what we train people to be, is
Correct.
medical billers for these medical providers. And it says here that we, our licensees, people we're putting into business in this business, will continue to yield the highest return on the investment for everyone. That includes the doctors out there. In other words, doctors can do their own billing, and they do, right? They use their own staff to do it. But it's not a good return on investment compared to outsourcing that to a medical biller.
Yeah, and I like the part where it is saying that other medical billing companies are rethinking their hiring and training and relationship management strategies. Well, one of the things that you will get here with American Business Systems is a large grouping, I like to say a great community of medical billing companies that we're always learning, we're always rethinking. Patrick, you and I and Jordan and the rest of the team, including Adam, we're all looking for new ways, better relationship management strategies.
Right.
So being a part of the nation's largest group of independent medical billers in the nation, this is actually going to help our medical billers get that ROI that's expected for the doctors, and boy, do they need it. I mean, that's really where the rubber meets the road.
Yeah, the doctors are hurting right now because of all the different changes in the healthcare system and the 30 million uninsured Americans that will have access to healthcare now.
Yeah, and Patrick, just kind of put hand in hand together here. As you can put up here, we found this one also. This is Market Watch, and this was October the 1st. So we're just talking just 2 or 3 months ago. 10 careers boosted by Obamacare. Well, medical billing encoders. And Patrick, I think you can probably read a little bit better on there, but I'm telling you, folks, if you go to this website right here, marketwatch.com, and check this out, actually the next slide over, this is a set of slides here, the next slide over is actually consultants. And isn't that what we position our licensees to be, as medical billing consultants? So
Yes.
Here are actually 2 careers that are going to be boosted by Obamacare.
Yeah. And I think you've actually got the quote here on this next slide that's right there on the front page, kind of blown up where everybody can read it. With millions of new patients comes millions of bills. And even before those bills come in, the work is piling up for physician and hospital billing offices, which are racing to prepare for the new ways they will have to submit patient claims to insurance companies. So it's right down, it's explaining to people that there is a huge, well, like it says here, it's been boosted. Our industry has actually been boosted by Obamacare, and of course, you and I have covered that in some previous webinars as well.
Yeah, and let me state that, folks. We have archived all of our webinars. So if you missed a webinar back in October, November, December, and I guess back all the way to September, Patrick, you and I really started dealing with Obamacare and how it is affecting medical billing and medical billing companies. So, folks, please go back out there. If you need help, we'll be more than happy to point you in the right directions. They're all on our blog, so you might want to go back and check some of those webinars out. But let's keep going here. I mean, I'm excited about what's happening in 2014. Go ahead.
Yeah, well, this continues, this same article, along with the requirements to transition to electronic health records. That's a big thing for 2014, right? Transferring all their information to electronic records. Doctors' offices also have to comply with a new system of coding the services that they provide, known as the International Classification of Diseases, or ICD-10. The system includes a whopping 69,000 diagnostic codes, and physicians will have to submit claims with the new labels starting October 1st of this year.
Yeah, so folks, we're just within now 10 months, if you could actually say less than 10 months now, since we've started January here. Folks, it really does get down to the issue of this. And as a matter of fact, there was another article, we didn't have time to get it up on the webinar today, but there was an article that was written by a doctor saying if the other doctors are not ready to switch over to the new diagnosis codes come October 1st, they're not going to get paid, Patrick, and that is huge. Now, let's not scare anybody away about codes. Why don't you discuss about real quickly about our codes and how they actually operate within our system?
Yeah, they're actually built into our system. Since it's a web-based system, the codes are always updated by our certified coders behind the scenes. So let's say you log in today and the codes are a certain way, and next week when you log in, they've been updated. Well, we've updated them behind the scenes so that when you log in, you are always seeing in real time the current codes. And that's why our ICD-10 codes are actually in the system right now, even though they don't have to be used until October 1st.
And it actually is providing a great way right now for our new licensees and those that are on the call today that might be joining us here in January. We're always looking for ways to get you in the door. And one of those ways is we're going to actually help you convert the doctor's ICD-9 codes now to the ICD-10 codes. We're going to actually help you map those out. So, folks, if you're looking for a good door opener, now is the time. And Patrick, I think you've got some charts in here that'll explain that as we continue to keep going on here.
Yeah, so the bottom line, guys, is that you don't have to take any special courses at your local college or online that have to do with medical coding. That's a big misunderstanding out there for people who are not in the industry, thinking that they have to be coders to do the billing for doctors. Those are two separate things. First of all, the doctors are going to provide you the codes on what they call their super bill. We'll show a picture of it here in just a second. And you are just going to type the codes into our system. Now, if those codes don't match what they should be, the system will tell you that. That's the nice thing about having an up-to-date, real-time web-based system.
Exactly. Well, you've got another slide right here talking about the top 10 challenges, and this is out of medical economics.
Yes, this in fact is the basis of most of the rest of our webinar today, folks. A lot of the quotes that we're taking is from this because they listed those 10 challenges. Now, we don't have time to cover all of them, but we'll cover quite a few of them throughout the webinar today. This is a quote directly from that article, and most of the next few slides are. While this list of 10 challenges facing physicians seems daunting and nearly insurmountable for smaller office-based practices, they're talking about for the doctors themselves, many believe there is tremendous upside for primary care physicians in leading healthcare delivery in the United States in 2014 and beyond. I think that's a very positive spin on this whole change with Obamacare, that even though, yes, the government is getting involved in this, it's the primary care physicians that are out there seeing patients face-to-face every day that are going to be in the lead on the healthcare here in the United States, starting this year.
Then you've got the, and it continues here, the results could even mean more autonomy. So it can mean better quality of life for you and your patients, and the hopeful results in less interference with the doctor-patient relationship. Again, folks, what this is talking about here is that we're going to, because of what we're able to deliver to the doctors and some of the things that they're needing, these are the challenges that are going to be resolved by really what's coming up here on the next slide here, because, Patrick, you've got a great graphic here about our full revenue cycle management portion of it.
Yeah, let me point out, though, that the importance from this quote here is that we want to help the doctor not to let all these things coming down from the government interfere with their relationship with their patients, because, folks, that's where they make their money. That's where their heart's desire is to help people who are sick get well. That's what they spent, $500,000 going to medical school to learn to do. And so they want to interact with their patients, not get bogged down in all the, ins and outs of getting the money from the insurance companies or from the government agencies that are out there.
Right. But here you got the full revenue cycle management graphic that we've shown in the past, combined with this quote here, but physicians will need to reinvent their operations to create efficiencies and thoroughly evaluate the revenue cycle to maximize cash flow. Now, again, you would think that we have written that out, and again, this actually came from the
That
article,
yeah,
that was talked about the top 10 or the top 10 challenges that doctors are facing. And folks, this is what you've got to really understand here, is that that's what we're doing for you in our training classes and how we support you. We are providing you a way to use a system, use the system that's been 20 years in the making, and we're positioned at the best time of your career of getting involved in this, because you're going to be able to help those doctors reinvent and help really get those efficiencies going through.
Let me throw this slide back up on the screen just for a second that we started with, so that people can get a grasp of this. Folks, these are quotes from this article. We didn't put these words on the screen. In fact, look at the date. It's right here. I'll circle it here. I think I can do that. Oops. There we go. It's right here. December 25th. This article just came out. Go to medicaleconomics.com and you can read this article for yourself. All right, so let me get back to that slide that we were on there and talk about the revenue cycle just briefly. This is what we cover in the live workshops that we do here in Dallas. When you come, you'll see that we touch on every aspect of that revenue cycle they're talking about there to maximize cash flow for the doctor. Eric showed you my book. It's called Cash Crunch to Cash Flow. That's because all we do is teach you as an ABS licensee to go in and solve the cash crunch that doctors are facing in today's medical market. And then they go on to say that means that you will need to re-engineer workloads, workflows, and staff responsibilities. Now, people ask us all the time, Eric, about, well, do I go in and is somebody going to get fired, because I'm taking the billing? Because if the doctor's doing the billing themselves, their own staff, that's a possibility, right? But look what this says. It's talking about re-engineering the workloads for those people. That is, helping those people, help the doctor to see those 30 million uninsured Americans that are going to be moving into the healthcare system this year, and reallocating what they now do to the things that they really would rather be doing, interacting with the patients and helping the doctor. Listen, that's not what people got into a medical office to do, is to mess with all the insurance billing. They have to, because that's how they have to get paid. But that's not what they wanted to do. Yeah,
and I think I was given a demo the other day, Patrick, and someone says, oh, so really what we're doing, we're helping them refocus on taking care of their patients. And that's exactly correct. That's exactly what we're doing. We're not trying to get anybody fired.
No.
Remember, we're consultants. We're here to help the doctor maximize their cash flow. And if the doctor sees that, or certainly if you see someone just kind of loathing around in the office, you go, hey doc, you might want to consider that. But we really are working with our licensees to work with inside that office to do what I would consider to be performance improvement inside of that office there, Patrick.
Yeah.
Getting the maximizing of everybody working towards the main goal, and that's getting the doctor paid.
And we know that, again, since the doctor makes their money by seeing the patient, they need to see more patients more efficiently, and that's what their staff can help them to do. This article goes on to say there are trends that are interfering with your time with patients and continually threatening the economic viability of your practice. Eric, I could get evangelistic about this. This is a great article, because it's telling doctors that your time with your patients is what makes you money in a roundabout way, right?
Yeah, and Patrick, we've all gone to doctors, and usually the doctors, and most of the doctors that we pretty much stay with because they're interested in our care. But what we don't know as patients, what's in the back of the minds of that doctor? Gosh, am I going to get paid today? How am I going to meet rent? Now, you understand, there was an article that came out I remember a year or so ago that talked about when we can help these doctors stay independent, it relieves them, and they can be more focused on our health care. That's what we want. So in
Sure.
general, folks, what we're doing, we're actually helping the community of everybody that's out there when we can help relieve the pressure of that doctor getting paid.
Yeah, there are big changes coming. Everybody knows that. Because of the Obamacare, the whole Affordable Care Act, that's going to change the way things work here in America in our healthcare. And as this slide illustrates, healthcare is in the throes of great change. This is a quote, direct quote from that article. And history has shown that large-scale disruption includes innovation. Don't you love that?
I do.
Disruptive innovation.
Yeah, and Patrick, we've actually done some webinars on disruption. We've talked about people that have made money on economic disruptions, and that's what we're here. I mean, that's what we can actually find in doing as entrepreneurs. This is how we find to make things better.
Continuing, a direct quote, our collective opportunity as a healthcare profession is to build a stronger healthcare delivery system rightfully led by the primary care that seeks to remain cost conscious, efficient in its delivery, and fairly compensated for helping people attain the most precious commodity of all, a healthy life. Doesn't that make you feel good, Eric? We're actually helping people get well by refocusing the doctor on the patient, not on the paperwork.
Exactly, and that's where we want to be able to do. And now, which leads us into, my goodness, we're almost halfway through to basically the top challenges the doctors are facing in 2014.
We may not get through this whole thing. Let's just see how fast we go here. All right.
Absolutely.
One is, in this article, says payment for medical services. Now, Eric, of all the things that they could choose, the number one challenge that doctors face in 2014 is payment for medical services. And isn't that exactly what our licensees help them with?
Exactly. Yeah, because it goes on to say here, tighter negotiated payments by health insurers, escalating costs of doing business, and the seamlessly endless cascade of bureaucracy tied to payments. Relief won't be felt for physicians for some time.
That's right. Unless
Patrick,
an ABS licensee comes in and takes it over.
well, it goes back to that article that you and I were talking about earlier on, is that medical billing companies are having to rethink of what they're doing. Now, that's what we do here at American Business Systems, is that we're always rethinking, providing you with a lifetime of support to get you to these areas where you can help the doctors. So that's one of the reliefs our licensees face, is because we're actually, you and I and the rest of the team, we're all looking forward to rethinking of how business is done for these doctors.
Yeah, folks, you see this picture of this poor doctor here. Our licensees will tell you, we have licensees that will tell you that they have salvaged a medical practice. Eric, you ran into a doctor just, it's been about 3 weeks ago, hasn't it? A month ago?
Right.
That sat down with you and said that very thing.
Yep, he says, if you can't help me get a hold of this, I'm just going to quit medicine and go do something completely differently. Yeah, doctors are they're feeling the pressure, they're feeling the issues that are going on, the bureaucracies that they are having to meet and jump through all these hoops. Again, folks, we just said that the codes are changing in 10 months, and doctors are trying to figure out, oh my gosh, I've got to have electronic medical records system. I got to make sure that my bills are going out, and oh no, I've got new codes I have to deal with.
Right. Yeah. And then look at this poor office manager. She's on the phone with an insurance company.
Yeah.
And again, we're quoting from the article here. High deductible health plans will also pose business challenges for most practices and will require a more aggressive collection policy. Now, can you imagine, Eric, the nightmare for an office manager who's told, now you got to get more aggressive with getting on the phone, not just with the insurance companies, but with the patients as well, collecting. Right. Now, Eric, we have solutions. We just happen to have solutions that allow the doctor to get more aggressive on their collection policy without being mean and without turning people off, right. Because that can turn away business for a doctor if word of mouth gets out there. Typically, doctors only collect about 50% of all the patient balances. and that results in almost 60 billion in bad debt annually, according to McKinsey.com's website. So we have solutions to that, folks. Look at this quote from the Center for Policy and Research. Typical medical offices have an average days sales outstanding of 52 days, and more than 20% of their AR balance is 120 days out. So that's 120 days. That's 4 months, right? Yeah.
Right.
We can solve that, folks. One of the things that we can do is take that 29% of claims that were received from the healthcare provider more than 30 days after the service was provided and get that lower. It says here 15% of the claims were received from providers for more than 60 days after the service was provided. That's from the American Health Insurance Plans. So one of the things as an ABS licensee you'll be able to do is solve that problem of collecting from the patients more of the money that's due to the doctor for what the patient owes through a service called Choice Pay. And this is just an option for the patient to be able to have that money automatically taken out of their checking account or bank account and just pay that doctor out without having to worry about paying a big lump sum up front when they walk up to the counter there. Yeah,
let me explain why this is important. Folks, I mean, we already know that Obamacare has already started. It is in effect. And what has happened is that we've got more patients that have higher deductibles. With Choice Pay, this will allow those patients to pay that big, larger deductible over time, still be able to meet their requirements through their insurance. But this actually gives the doctor the opportunity to collect that money because, Patrick, you know and I know that a lot of the doctors sometimes write off those deductibles and they never get paid on those things. And that's the doctor's money.
Yeah.
And so that's where we're trying to help the doctor. We kind of just think here kind of short-sighted. Well, the doctors mainly get paid from the health insurance companies. That's a chunk. Right. But this other chunk is coming from the deductibles and those co-pays that sometimes never get collected.
Right. And we show the doctor through, like my book here, goes into detail as to how they can solve that problem by utilizing one of the services that you offer there called Quick Collect. We can recover their profits and get them more money in faster using these services. Now, folks, we can't go into detail, of course, on this short webinar about these services, but read about these on our website and ask your ABS consultant more questions about these different services to find out more about them. There's a whole bunch of them out there, and we, again, don't have time in this webinar. We do go in detail in some other webinars, but there's lots of different things you can do besides being just a medical biller. That's the mistake a lot of people make when they get into this business, isn't it, Eric? They go out there and try to position themselves as, hey, I can take over your billing. Well, sometimes the doctor's not interested in having you do that. They think everything is just fine right now in their office. Or they've already outsourced it maybe to another medical billing company, and they think it's fine. So you can sometimes open the door with these types of services and get into the doctor's offices kind of like in the back door and provide other services for them as well that save them money.
Well, Patrick, aren't we working on other things currently right now that can actually get them in the door with some of these mandates of what we're actually into right now, the government mandates of these audits that these doctors are facing? So folks, we are always working on new solutions and new services based upon what we're dealing with today, and that is these ICD-10s are coming, and we can help them through some audits and get them going here. So Patrick, let's talk about these ICD-10s again.
Yeah, we mentioned this earlier. Let me show you a picture here of the a typical super bill, they call it. It's just a worksheet that the doctor uses in their office. You've probably seen something similar to this. The doctor circles some numbers in there. Let me zoom in on this next slide. It'll get a little closer there so you can see those. They're just numbers. Look like 5-digit numbers that cover the procedures, what the doctor does for the patient, and then down below here you'll see some also some diagnostic codes down there at the very bottom of the screen, and those are just codes that the doctor will give you electronically now, not on a piece of paper. We're totally paperless, but you'll get those codes from the doctor, and once those are in our system, of course, that's how the doctor gets paid. And as this screenshot shows, Eric, this is showing the ICD-10 right there along with the ICD-9s that are currently in use, aren't they?
Exactly, and you can see, you can Patrick kind of circling those right there, but you can see whenever I mentioned earlier that we can help the doctors currently that are on ICD-9s, you can click on that button right there where it says ICD-9 map, and we can map out the new codes for the doctor. That's how a lot of our licensees are getting into the door now, is because we're going, doctor, we have the capabilities of helping you with that, because listen, it's costing the doctor up to sometimes $30,000, $40,000, $50,000 just to get those things mapped out like that.
Yeah. So one of the things we can keep the doctor and the office manager from having to do, and you as an ABS licensee, is to have to learn anything about those codes in detail. There are, again, whole books written on those codes. You don't have to know them because they're in our system. So that's one of the mandates that are coming down, that the doctors have to switch to the ICD-10. Here's another one. Eric, tell them about meaningful use stage 2. What is that?
Yeah, meaningful use stage 2 is another set of requirements that the doctor has to meet for them to get reimbursed on some reimbursements there for using electronic medical records. I think we actually have a graph of that coming up here just shortly. But you can see that we've already met the stage 1 meaningful use criteria. And again, you can see up in our upper right-hand corner of our screen that we're already certified meaningful use stage 2. So, folks, the doctors will ask you, are you stage 2 meaningful use? Absolutely. And so these are just some of these dates that you're seeing here up on the screen. Now, this is what I was mentioning to you earlier, is that the doctors can get incentives for being on an EMR system. Now, here we are in 2014. So if there's a doctor out there that has not gotten on the EMR yet, they are still qualified to get at least $24,000. Well, folks, that's better than a poke in the eye for most doctors.
Right.
Because you can see here for Medicare, their first year of being on it, which would be this year, 2014, they're going to get $12,000. For 2015, they're going to get an additional $8,000, and then finally for 2016, they're going to get the other $4,000, totaling the $24,000 there. Now, you can see how things start dropping off here going into 2015. Why is that? That is because all doctors are supposed to be on a EMR system by the year 2014. Now, there won't be any money that they'll get for 2015. There won't be any penalties for 2015. But coming in 2016, if they're still not on an EMR system, now they're going to start getting penalized. So, folks, when we say that this is the year to be in all this is a great window of opportunity here.
Yes, it is. Now, if they're taking Medicaid, of course, which a few doctors do, not a lot, there is money available for those in 2015 and 16 as well. But most doctors are taking Medicare if any type of help from the government at all there. And then here's another mandate that's coming down. The new HIPAA rules. HIPAA is the Health Insurance Portability and Accountability Act that protects as it says at the bottom, administrative simplification, privacy, security, transactions. It's all about patient privacy. And believe me, you can walk into any doctor's office, Eric. You do this all the time, and you can almost just visually see all sorts of HIPAA violations there in that office, can't you? Because there's stuff laying around with patient information on it that just shouldn't be.
Yeah, matter of fact, you and I and some of the other team we were on a webinar before the new year, and we found out that if a doctor is in a restaurant or just at lunch and he's talking about this protected health information about one of his patients and it gets overheard, that patient can actually sue that doctor for violating HIPAA rules and this protected information here. And folks, that's what we're talking about here. We are just and we have solutions for this. That's the good thing about what we have here at ABS.
Yeah, you'll hear this term PHI. That's the protected health information, which is personally identifiable health information of a patient that's maintained or transmitted in any form or medium. And you just would not believe the violations that go on in a doctor's office. We're working right now on a solution that will just blow the doctor's office away, that can solve their worry about the government coming in and fining them for violating some of those HIPAA rules and regulations. You can become their HIPAA compliancy officer, basically.
Exactly.
The fines, like I just mentioned, depends on whether or not they knew about a breach and had reasonable cause to know about it, and they were willfully neglecting and had corrected it, or willfully neglected and not corrected it. But look at some of these fines, Eric. Some of these fines are $50,000 per violation.
Right.
So anyway, we've
Yeah.
got some terrific solutions for that mandate as well. Here's another one. We like these acronyms, don't we? PQRS. This is the Physician Quality Reporting System that rewards the practices for successfully reporting on 138 outcome quality measures. So, in other words, the doctor is paid not just on the time spent with the patient, but the quality of the outcome. And 2014 is the last year that financial rewards are available. Beginning in 2015, they turn into penalties. So again, you can solve those problems for the doctor as well. Okay, Eric, I'm moving on here. Number 3. Boy, we always cram more in here than we think we can get in an hour, don't we?
That's okay.
Payer headaches. Now let's talk about that just for example. Getting done what patients need will be very difficult. Payment-wise, medical doctors have no say. Take it or leave it. That's right out of this article. I'm just continuing to quote right out of that medical economics article. Doctors have no say. Take it or leave it.
Yep.
And they don't like that, but there's not much they can do about that. So who's in charge? Well, insurance companies. They dictate which doctor and which medicine and which test and how long in the hospital. And they've planted themselves between the patient and the doctors and on top of the money pile. That's what it says in this article, Eric.
It's amazing, these quotes that you're pulling out of this article. Again, these are some of the same things that we've talked about in the past. And again, how our licensees are positioned to get that. Wow, this article from the American Board of Family Medicine 2013 study, with more time and staff dedicated to communicating with payers, prior authorization activities can cost a practice up to $3,400 per full-time physician.
And Eric, we can help them with that for sure, can't we?
Exactly.
Using our electronic medical record system,
yes.
All of that authorization can be done in real time, right through the system itself.
And let me explain that, because some people say, oh yeah, I can get my pre-authorizations and my eligibilities done online as well. Well, not within your system. And it's key for that because, Patrick, I know we've talked about this in time past, but let's just clarify why I say that. And that is because we own our own clearinghouse. Folks, if you don't know what a clearinghouse is, we'll be more than happy to talk to you about that in a little bit more detail on a one-on-one basis. But let me just tell you, everything works together. I think you like to kind of put it like this on the whole Apple concept. You know, the same people who make the computer also make the software. It just works. And so that's what makes this work, and these pre-authorization and these eligibility checks online capable of being able to do that. Certainly reducing this cost to the doctors.
Yeah, like this is illustrating here, most doctors' offices literally do their authorization over the phone. They get on the phone and spend about 18 minutes on average waiting for the insurance company to authorize that visit with that patient. Ours is done in real time with a click of a button through our system because we are the clearinghouse.
Exactly.
And again, the clearinghouse is a very important factor that you don't want to have to deal with on your own. We've taken that away from people having to deal with that by having our own. Okay, time is another thing that this article says that is a huge challenge for doctors. Every year, physicians complain they're spending less time with patients and more time dealing with the noise that surrounds the business of medicine. In 2014, it may be deafening. The noise may be deafening.
So what is the noise, Patrick?
The noise has to do with all the requirements that pull the physicians away from seeing patients and helping them become or remain healthy. It's the government's regulations and the private payer requirements that they must meet. It's the day-to-day difficulty of trying to run a business, not having enough time to do that. Thanks for setting me up on that one.
Yeah.
So, folks, this year could be the perfect storm that forces physicians to spend even less time with their patients. The rollout of the Affordable Care Act, as I mentioned earlier, means business uncertainty, new requirements, and a possible floods of newly insured patients. We hope
I
they can
think
get.
this I think this helps illustrate what we talk about in the past, Patrick, that doctors, if they're doing billing in their own house, in their own office, they're actually running two businesses. They're running their healthcare practice, and then
Yes,
they're trying to run a medical billing company.
right.
This is where you, as a possible licensee with American Business Systems, can help relieve those doctors of that work.
They should be focusing on their core competency, which is
Correct.
helping patients get well. Oops, I went backwards there. Okay. Number 5, challenge. Technology costs. The cost of technology is quite a shock to some doctors.
Yes.
Fresh out of medical school, they don't dream what they're going to spend on the technology, including billing software.
Yeah, practice owners can expect some high, big health information technology expenses in 2014. And you know what, Patrick? Even I know even our licensees experience that when they go talk with new doctors, getting them set up. Because number one, this ICD-10 is going to go into effect in October. Then they have the EHR, electronic health records. That's the cost of doing that. And then HIPAA compliance continues to be significant. And we talked about this compliance issue costing the doctor money. Now, very interesting. I just got, part of what we do and teach, Patrick, we do a practice analysis, and that's one of the things that we teach our licensees to do. I just got one back from one that was done here locally, and one doctor is on his services, just on the software services, is spending over $3,000 a month. That's not counting what they're paying someone to do the billing. That's
Right.
just what it's costing them to run the software.
Yeah. The access to a good billing system, especially if it's an online cloud-based system like ours is, and the support and the training and the ongoing user fees and so forth, very, very expensive. You can take all that away from the doctors, not having to worry about that. Many practice-based physicians, this article says, will be challenged to find time and resources to fully understand all of these programs and associated operational implications and implement new and updated supporting technologies while focusing on their primary role, again, patient care.
Correct.
In fact, it's going to be impossible. I can tell you that there will be doctors who will go out of practice this year, Eric, trying to implement all these new electronic health records and ICD-10 codes and so forth. They're just not going to be able to manage all that on their own. Look at the cost of an average electronic healthcare system. In office, their upfront cost can be $33,000 on average, some much more than that, and their yearly cost $4,000. And if it's a web-based system, it can be even $26,000 up front and $8,000 yearly cost. We take that away from the doctor. They don't have to worry about that, folks.
That is correct, and that's the beauty of our system and how we help you position yourself. Because a lot of people are worried, Patrick, how am I going to get the doctors to go with me? And those are the things that we teach you.
Yeah.
And how to position yourself as not only cost effective, but really, again, solving those cash crunch problems and getting that cash flow to come back into the office. All right, let's go to number 6, staff and training. This is another factor that you read in that article, Patrick.
Yes. Here's a quote from it. Flexibility and efficiency, those two qualities will be crucial for staff recruitment and training in 2014. For many medical practices, survival in the changing healthcare landscape will require staff members to embrace a team-oriented culture and take on new roles within the practice. We mentioned this earlier. What are those new roles? The new roles are actually helping the doctor to process and see the influx of new patients that they're going to have starting this year.
Yeah, because they're faced with this new health exchange. We know that a lot of people, Patrick, have gotten signed up on the new healthcare ACA or /Obamacare, but some of those people are finding out that they're not even covered yet. So those are some of the issues that these doctors are going to be faced with. Patients coming into the office, feeling like they've got a product, and come to find out that they don't have one at all.
Yeah, the new healthcare plan sounds good in theory. but it's not about people just getting health insurance. Are they going to actually be able to get the health care that they need to stay well and to get well? And as this says, practice owners should anticipate additional hours and costs required for staff training. Right out of this article, again, folks, we're not saying this. The article says doctors have to get ready for this. You can help doctors with this by helping them with the business side of their practice and letting them focus on the clinical side. All right, number 7, putting control back in the hands of physicians. This is a quote from the Rand Corporation. It's getting harder for solo practitioners to keep their heads above water financially, and their love for practicing medicine seems to be fading. Physicians feel they are doing a good job when they're providing quality care. Eric, you would have thought you wrote that.
Well, again, we hate to sound like a broken record, but this is the issues that doctors are facing. And a lot of these things that we're showing you, again, these are not Patrick's words or my words or anybody else's. We're just truly showing you what's really in the market here.
And then we have this question come up every once in a while, Eric, from people about getting into this business. They say, well, aren't the doctors all being absorbed, by all the hospitals that are out there? And as you can see from this quote, from the American Medical Association's own survey that they did in 2012, it's widely believed that better working conditions are leading primary care doctors to flee to hospital employment. In reality, most primary care physicians continue to own their own practices.
Exactly.
So much for that. Okay.
Yeah.
Number 8, challenges changing patient populations.
Patrick, we already mentioned that in that Market Watch article, talking about the enormity of people coming in, but again, in the article that you were talking about, it says here millions of Americans without health care insurance or health insurance will soon have it because of the Affordable Care Act. Many of those newly insured individuals will try to see a primary care in 2014, or is it actually how many will it? Yeah. These patients will present new challenges to physicians when it comes to both providing care and anticipating revenue. And again, folks, here's going to be the challenge. There's going to be a lot of people who have health insurance, and they're going to flood the doctors. And then there's going to be some of those people that think they have health insurance. They're going to flood the doctors to find out that they don't have health care.
Right.
These are some of these challenges. This is just the real world where we are. And again, we will be able to meet that challenge and help those doctors with those challenges.
Eric, we've said this before in training. How do you get rich in business? You find a need and you fill it.
That's right.
That's all we're doing. All we're doing, the need is already there. That's what we're trying to prove to you with all these quotes, folks. The need is there. If you're thinking about getting into a business of your own, you don't have to create this need. It's out there. We just show you how to go out and solve the problems and the pain that the doctors have. Now, here's a quote from the MGMA, the Medical Group Management Association, which we're members of, ABS. And it says, as Medical Economics reported in its December 10th, 2013 issue, as many as 80% of these newly insured patients are at high risk of non-payment. So, just like Eric just said, all these new people coming into the system are at high risk of non-payment to the doctor because of what they're going to owe. Like Eric said, there's higher deductibles and upfront costs from the patient. And the president of this MGMA, Susan Turney, says that collecting from self-pay, high deductible, or health savings account patients is one of the biggest challenges identified by their members.
Folks, we have the solution about that. Patrick mentioned that earlier, of choice pay. We've got a solution to help these doctors with that. Matter of fact, Nate Davis from ZerMed says there aren't many industries that the customer pays so far after the service is performed. Physicians need to get out in front of the payment. Now, that's what we're talking about here. We're talking about getting in front, being more proactive. That's when we talk about, Patrick, about the eligibility request. That's really one of those proactive ways that we're talking about getting in front of that payment. He goes on to say this is a big change in the mindset of the industry. Providers won't be able to afford to collect payments after service for much longer.
Right.
That's just unbelievable that doctors have that mindset. And sometimes even when we present these services, they go, "Oh, I don't do business that way." That's where we've got to become consultants, Patrick. And that's where we really got to help these doctors understand some of these issues.
Yeah, it's the way we train our licensees, folks, is to do what's called educational marketing. That means we have to educate through some of the marketing materials and methods that we teach you to educate the doctor and the office staff that this is the way it has to be if the doctor wants to solve their cash crunch problems. Okay, number 9, we're getting close here. Work-life balance. More than 73% of physicians surveyed by Medical Economics work more than 40 hours per week, and 24% work more than 60 hours per week. Next year, physicians will confront uncertainty as the Affordable Care Act takes full effect, it says. Practice owners will continue to face declining reimbursement struggle to keep their businesses viable. Folks, don't let anybody fool you. A medical practice is a business. And if it doesn't show a profit, it can't pay its staff, it can't buy new equipment, it can't expand, it will die. And you can solve that problem. So physicians decide they need to work longer hours and even second jobs to stay afloat. Now look, this is from Medical Economics magazine, the one that sent out to doctors all over the country. About 36%, Eric, of primary care physicians moonlighted on a second job. Can you even wrap your brain around that doctors have to moonlight because of their cash crunch problem?
Well, we have doctors, as you well know, we have doctors that are already a licensee of ours, and we know that if we need to get in touch with any of those doctors, it's hard to get a hold of them because they themselves are working longer hours, and it's not because that they need more money. There's just a higher demand, and so with the higher demand of their time, plus some of these doctors that are having financial struggles, I mean, it truly does take on a real challenge for these doctors. And Patrick, Ron has asked a question here, and since we're kind of at the end and we got about 3 more minutes here, I thought I'd try to squeeze this last question in here. He says, now that patients need to be registered in EMR, that's electronic medical records, how do you register those patients who rarely see a doctor? And he goes on to say, when they arrive at the doctor's office or at his records expected to already be registered. Now, with our system, we know that if they're utilizing our system properly, a lot of that information, especially their patient demographics, can automatically be loaded in there from the patient's insurance company. That's how that can happen.
That's right. And if the doctor's utilizing our patient portal, the patient can actually go to a website and fill all that in, and when they show up at the office, it's there.
It's all there. So we've got what's called a patient portal, Ron, that will allow the patient, and it's helping the doctor to eliminate all the paperwork. Because remember, when you get to the doctor's office, you're filling out this patient information form. Then somebody has to take it, Patrick, input that. Hopefully, there's no mistakes that happen. But what if we give the patients that opportunity to input all that in the internet, and it's right there for the doctor as soon as they walk in? That's what we're able to provide to the doctors.
That's the advantage of a web-based real-time system. Okay,
Exactly.
Well, Eric's already mentioned to you folks about this live training workshop. Like he said, it is over half full already, and as you can see, there's not that many seats in these classes. We try to keep them purposely small so that you have the attention of our instructors for that whole week. You'll be able to ask every question you want to possibly ask during that week. And as he mentioned earlier, I'm going to give away to everybody in the January class only, this coming January class, everybody gets the iPad mini. We hand that out at the training workshop. You'll take it home with you. Absolutely. And by the way, we have a lifetime money-back guarantee that we've come up with, 100% money-back guarantee. If at the end of the training workshop, for any reason you don't think this business is right for you, just tell any staff member, and they will arrange for you to receive a full refund of your license fee. Now, if you're wondering how we stay in business, by doing that, we've only been asked for that about 3 times in our whole 20-year history. But folks, it's real, and we do this because we know what we have is real, and you'll see that when you come to the training workshop.
Well, Patrick, this hour went by so fast. It's unbelievable. We had so much information to give you. Folks, if you missed any of this, we did record this. If you want to go back and listen to it, take some notes, and then give us a